Vas, after a good performance in 2017, you want to enter a next growth phase in 2018. What will be its drivers?
The key growth drivers for the next growth phase at Novartis are going to be our recent launches of Entresto and Cosentyx, which have performed extremely well in 2017 and have strong momentum moving into 2018. Along with that, our oncology portfolio of new medicines, both that we acquired through an acquisition of oncology drugs from GSK, as well as 3 new recent launches, continue to perform well and are starting to accelerate. So we feel like in 2018, oncology will start to contribute as well to that growth. And then lastly, it's important to note we have 12 upcoming major launches over the next 3 years. And these launches will help us continue to add to that growth momentum at the company.
If you could maybe tell us a little bit more about those launches that are coming up.
There's 3 big launches we have in the very near term. One is a drug called Aimovig, which is for preventing migraine, which is one of the biggest causes of disability for patients around the world. It's a 6th leading cause of disability, and these are terrible headaches that patients get. Aimovig, we hope, will get approved in the US and Europe over the course of this year, and along with our partner Amgen, will be a major launch. The second is our revolutionary cell therapy for cancer, Kymriah, will get approved in a new indication for adults living with a disease called diffuse large B-cell lymphoma. And with this launch, we'll also be able to make Kymriah into substantial medicine for Novartis. And then lastly, we'll have 2 upcoming filings this year, which are very important for the company. One is in multiple sclerosis for a drug called BAF312, and then the other is in retinal eye disease with a drug called RTH. Those two filings and hopeful launches will be key drivers for us in the future.
Let's talk about Sandoz. The division is under pressure in the US. How will you reshape it?
We're in the midst right now of evaluating how best to reshape our Sandoz business in the US. What we know is we are a leader in biosimilars with one of the leading portfolios in the industry. We have a strong leadership in differentiated generics where we've been able to build a strong portfolio. And we have a leading business overall in the generics markets in the United States. So we're evaluating all options, whether it's strengthening the business through organic investment, looking at it, and as well as looking at external options as well.
So let's talk about Alcon as well. The division has returned to growth. Sales are up 4%. What are your plans now for the future?
We've been very pleased with how Alcon performed exiting 2017. And what we'd like to see now is continued top-line growth as the portfolio continues to deliver, both in terms of surgical equipment and surgical in terms of cataract lenses, as well as in the vision care portfolio, where again we're seeing a shift towards our higher-end medicines and products. Now, what we'd like to see as momentum over the course of 2018, and assuming that momentum continues, we'll be in a better position to determine what is the best path forward for Alcon.
Thank you. So last but not least, you're going to take over soon. What will you be doing differently?
When you think about Novartis, we have such a great legacy at the company, but there's 2 core areas I'd like to now accelerate our transformation. One is in the culture of the company to enable us to have associates who are inspired and empowered every day to bring their best selves to work, and that'll be a big element of the story. And then the other, as we've talked about, the data and digital transformation, where we need to get the best talent into the company, the best strategy going forward to enable us to accelerate that next change for Novartis.